Well, hey guys, in this video, we're gonna be talking about filler gone wrong. If you are new here, welcome. My name is Andrea. I am a board certified dermatologist. If you like skincare content, consider subscribing or following me over on Instagram or TikTok as I post on those platforms a fair amount as well. Filler has gotten increasingly popular. Its popularity continues to rise, likely because of short downtime, social media, making you feel like you have to have it. It's gotten really popular. It's safe, minimally invasive, and again, there's like no downtime with it. While uncommon, complications can occur. In this video, we're gonna be going over the top 5 complications you could encounter from getting filler. Number 1 is complications at the injection site. This is actually the most common adverse effect that one might encounter. It includes redness, swelling, pain, and bruising at the injection site. This is mild usually, and it's temporary. It lasts at most a week and then resolves. To minimize pain at the injection site, your injector may elect small needles or a blunt cannula. They're probably going to apply ice, numbing cream before injection so that you don't feel any discomfort. To minimize the risk of bruising, you will likely be counseled to stop any blood thinning medications like aspirin or non-steroidal anti-inflammatory medications a week beforehand so as to minimize the risk of bruising. You also have to be mindful of dietary supplements. Dietary supplements can increase the risk of bruising and bleeding. These include vitamin E supplements, garlic supplements, turmeric. Discuss with your injector beforehand any dietary supplements that you are taking because some of them do inhibit clotting, and this can be a good thing, but in the case of getting injections, it's going to make it more likely that you have bruising. All right, but let's get into some of the more serious issues, serious but rare issues that you can encounter. Number 2 is complications due to just bad injection technique. You can develop nodules, and you can also get overcorrection or undercorrection. If the filler is injected too superficially, meaning not deep enough in the skin, it can lead to these little blue nodules. That's called the Tyndall effect. Sometimes if you get bleeding down in the deeper layers of the skin with the injection, that can lead to something called hemosiderin, which produces kind of a brownish pigment. In some cases, especially around the nasolabial folds, you can get a small nodular column that's almost like a ridge if the filler is injected too superficially. This can be dissolved with the enzyme hyaluronidase to help that go away. If your injector injects the filler radius, otherwise known as calcium hydroxyl apatite, and then if they inject too superficially, you can get these little white nodules. Number 3, again, rare, but it does happen, and that is an allergy or a hypersensitivity reaction to the filler. Hypersensitivity reactions and something called a foreign body granuloma, this can appear days to years after you've had the filler placed. Usually it presents as redness and kind of a swollen thickening that's called induration. Fillers that utilize bovine collagen like Belafil, you can have a hypersensitivity reaction to the bovine collagen. Allergy test is done before that filler is placed to make sure that you're not going to have that type of reaction. These reactions, they can be right at the site of injection, and that's going to appear within a few days, just like an allergic reaction to it just within the skin. But in rare cases, you can actually develop like a total body allergic reaction with hives, fever, very unlikely. And again, before that type of filler, most people do an allergy test to make sure you're not gonna react that way. Now, foreign body granuloma is a type of hypersensitivity reaction. And again, this can appear years after you have had filler placed. Basically, it's kind of like a chronic buildup of an immune reaction to the filler, and it leads to either nodules, lumps, bumps, usually at the site of injection. Foreign body granulomas, they're really hard to treat. You may have to have steroids injected into them to get them to flatten out. Honestly, I'll never forget, I had a patient once who was like getting filler from somebody out of their garage. Like they're like, hey, I've got this filler, why don't you come over and we'll inject it into your rear end. And she developed the most disfiguring foreign body reaction to that. I mean, it was devastating. So it would obviously depend on the extent of the area filled. To what degree? I mean, in most cases it's going to be these nodules and swelling and tenderness, but it can be actually pretty involved and it can be very disfiguring. It's really actually quite hard to treat. You know, in the localized nodular form, you can inject it with, again, the steroids to get it to flatten out. You know, when we're talking about large areas, then you may have to be on medications that suppress the immune response. Yeah, definitely not something, but I want to make it clear, this is not like something that you are likely to encounter. It's just a possibility. Now with TikTok, you have these people on there who get those jet pen injectors. I did a whole video on this, but they buy filler on the internet somewhere. And those people, you know, I talked about why those jet pens are not good. So definitely check that video out. This filler that people get online from these random sources, non-authorized, you know, distributors, the likelihood of contamination, impurities, it's much higher. The jet pen, if you'll recall, I mean, here you can't control the depth where the filler is placed at all with that thing. So it's a perfect setup for the blue nodules, but now you're also having to acquire filler for which there is a high likelihood that it is contaminated, it's got impurities, and then later on in life, you're gonna end up developing a foreign body reaction to it, which can be so disfiguring. Yeah, I really hope that has gone away. The FDA issued a warning against that. Comment below, are you guys still seeing the jet pen injectors for filler online? It's just mind-boggling. Complication number 4, it's not super common, but it's definitely something that we're super mindful of, especially when injecting around the nose and in the glabella, which is the skin between your eyebrows and above your nose. And that is vascular complications, basically complications that come about as a result of injecting in a blood vessel, which you do not want, because the filler will plug up that blood vessel that's supposed to be feeding the skin above it, and when it's not getting blood, the skin dies. It's called necrosis. Inadvertent injection into an artery also can cause blindness, especially injecting around the nose and again in the glabella, because the blood vessels in this area, they all kind of link up with one another. So it's possible to, if the injector gets filler into the blood vessel, it can cause what's called an embolus. Basically, the filler migrates through the blood vessel, travels through the blood vessel into the vessels in your eye, and it can cause immediate blindness, eye pain. It is an emergency. There are a variety of interventions that would have to be done in that situation to try and lower the pressure in the eye in an effort to dislodge the filler embolus. Again, it's not a common complication. Experienced injectors, qualified professionals, they're going to know how to properly inject in this area and not, you know, put you at risk for that. And very, very rarely, you can actually develop a stroke if the filler lodges in a blood vessel that goes up to your brain. Again, very rare, but these complications can occur. To minimize this complication, using a small bore needle or a cannula. Some people aspirate the needle back before injecting to make sure that they're not in a blood vessel. You can see a little flash of blood. There are conflicting opinions on whether or not this is helpful or not, but that is another technique to minimize the risk of being in a blood vessel. And then injecting really slowly. I mean, you don't want to whoosh, bolus in a bunch of filler. A low density, low volume amount of filler, less likely to plug up a blood vessel. In the unfortunate situations where you do end up with filler in a blood vessel, there are a ton of different interventions and maneuvers to try and correct the issue, and it is an urgent issue. Some cases, sildenafil, which is Viagra, it's a vasodilator, so it helps to dislodge the filler by dilating the blood vessels. The enzyme hyaluronidase can be injected to dissolve the filler, and then also topical nitro paste. Low molecular weight heparin, which is a blood thinner, can also help. So there are a few things that can be done, but you just don't want to end up in this situation. And knowing the anatomy, knowing what plane you're in, these are all keys to good injection, so it shouldn't happen. I want to repeat this. This is actually a pretty rare complication in the hands of somebody who knows what they're doing. Number 5 is you can develop an infection. Again, very rare, but you can get bacterial infections, fungal infections, and viral infections. One viral infection or issue that can often happen with filler injection around the lips is if you get cold sores, you can develop an outbreak of a cold sore at the time of filler injection, and this can be prevented by administering antiviral medicines before the filler is placed. But rare types of infections are going to be bacterial infections, staph and strep bacteria. If they get introduced into the skin, into the deeper layers of the skin via filler injection where you're puncturing the skin, well, you can develop something called an abscess, which is basically like a little walled off infection. Or you can develop a more widespread infection in the deeper layers of the skin that's called a cellulitis. That has to be treated, both of those things have to be treated with what's called broad spectrum antibiotics, pills that you take by mouth to kill bacteria. And even rarer, the filler could be contaminated with what's called a biofilm, basically like a matrix of bacteria. When we're talking about aesthetic spas, doctors' offices, the filler that they're getting, it's, you know, from like Allergic or these big pharmaceutical companies. It's highly purified, you know, free of contaminants. So this becomes less of an issue. Infection, probably gonna be more likely if you were to go into someone's garage and have filler placed, that would put you more at risk. Aseptic technique, making the plan of filler placement such that it minimizes the actual number of skin piercings that have to occur. The more frequently you pierce the skin, the greater the risk of introducing bacteria. Now, the other thing is using a small gauge needle. I already mentioned this for minimizing pain, but it also helps minimize infection risks. The larger the needle, the more surface area there is for introducing microbes. Obviously not injecting on inflamed or infected skin. I mean, if you have a skin infection, it's just common sense not to inject that, because you're gonna pierce that infection right into the deeper layers of the skin, cause a serious problem. And by avoiding injecting into previous layers of fillers. All right, y'all, so those are the top 5 complications to consider when weighing the risks to benefits of getting filler yourself, whether it be on your lips or your face, elsewhere, or, you know, in your body. Filler can be placed in the hands to rejuvenate them. So these are things you may want to consider. A skilled injector is going to be thinking about these things and doing everything possible to make sure these things don't happen. So while this procedure is super safe, I want to emphasize that, like, these things, most of these complications, aside from, you know, the local injection site pain, discomfort, bruising, they're all pretty rare. But, you know, it's important to go to someone who's qualified and experienced. Definitely don't DIY it with that jet pen injector thing. If it sounds too good to be true, it probably is. You don't wanna cut corners with this. It's not like, you know, putting in your own wallpaper or something. If you don't like it, you can take it down. There are potential serious adverse effects. These foreign body granulomas that I mentioned, they're really tough to get rid of. They can be very disfiguring. So it's certainly not something to take lightly. Make sure you go to someone who's qualified and has a lot of experience, a board certified dermatologist or board certified plastic surgeon. If I recall back to my video on work I've had done, which is basically my teeth, I have never had filler, so I do still get that question a lot. Tell us about your fillers. I have never actually had filler. Not because of these potential risks, it's just not something I've ever been motivated to do, but I know a lot of you guys out there do get filler and are considering it, so hopefully this video was helpful to you all. Now that the mask mandate has been lifted in most places, a lot of people are, again, really more lip focused. So I thought it would be timely to make this video, All right, y'all, I hope this video was helpful. I know a lot of you all out there have considered filler, so hopefully this didn't completely scare you away from it. Again, most of these things are super rare, but just helpful to be informed and do your diligence by who you go to, make sure they're qualified. Of course, hydrating, moisturizing ingredients can plump up the skin cells on the surface and just kind of smooth out wrinkles and fine lines, but they're not going to replace volume lost in the face. That's gonna be filler and other aesthetic procedures. Speaking of gimmicky products, on the end slide, I'm gonna put my recent video going over Volufill as a dupe for filler, if you will. So definitely check that video out if you missed it. But if you like this one, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.